In next half an hour, I'll be talking about finding the right needle in the haystack. So my talk will be a general introduction to our program today and tomorrow. Okay, so while I'm no authority in biostatistics, whatever I learned during my residency and now while treating the patients, I will be talking about it. Let me start with a case. So this is a young man who presents with hypertension, microscopic hematuria and proteinuria. His creatinine is 4.2. You investigate him thoroughly and conduct a kidney biopsy. Biopsy comes back as IgA nephropathy and 5 of the 10 glomeruli have fibrocellular crescents. So this is the young guy you want to treat, and then what next? So what do you do? So whenever you come across a clinical query, so I just described you a case where young man presents with hypertension, hematuria, and biopsy shows IgA nephropathy with so many crescents. So the most common cases that we see are usually treated initially with non-immunosuppressive treatment followed by some immunosuppression if there is indication. So when someone presents with so many crescents, what do you do? So most likely we go to a classic textbook of nephrology, or we check up to date, or nowadays we consult social media or simple Google search. Or if nothing works, this is the best chance of you having a correct answer. But when we think about day-to-day clinical work, it's usually trying to find answers to questions. Whether we take rounds, whether we are seeing patients in OPD, answering phone calls, we are trying to answer questions. So when we answer clinical query, we have to find out the actual data points, analyze them, and give out a correct answer. So it could be, as I said, simple clinical practice, or it could be your thesis topic, designing a study, writing a review of literature, or writing protocol. All right, so, and at times when we conduct meta-analysis, we have to find out the right articles. So this is all literature search. So when we want to search the literature to answer our query, we have several resources, PubMed, Google Scholar, Cochrane Library, to name a few, clinical trials, registry. We must know the question, we must know our resources, and we must know how to use them better. So in next few minutes, I'll talk to you about few such resources and how to use them in right way.
Sir, on the Zoom actually the screen is not moving. So if you can unshare and share the whole screen instead of sharing one tab.
All right.
We have screen. Yes. वो share करेंगे.
हाँ. Now go to slideshow.
Now it is moving.
All right. As we know, PubMed is run by NIH in USA. It's a open access database. More than 36 million citations are indexed in that, and so many of us use it day in and day out, including doctors, nurses, researchers, patient advocacy groups. All of them find it useful. So let's talk a bit about PubMed. So you can learn about PubMed in the site. On the home page, you will get links to understand what the PubMed is and how to use it. But before we start searching any database, we must learn to answer right questions. So when you have something in mind, you must formulate a question. Unless you formulate right question, you won't get right answers. So as any one of us know, there are parts of questions that we have to formulate. So this is PICO model, where P is patients or problems, I is interventions, comparison and outcome. We must define all of this before asking questions. I'll give you this example. So the question in this case would be, do patients with IgA nephropathy who present with crescents fare better with immunosuppression than supportive non-immunosuppressive management? Here I am defining a patient population, that is IgA nephropathy with crescents. I am defining intervention, that is immunosuppression. I have comparison in mind, that is non-immunosuppressive management, and outcome could be anything. Here I have written a vague outcome, but it could be partial remission, complete remission, or whatever. So when I put in a simple search, I find so many articles, and then I have to pick and choose which article is of interest. So let's start our journey. So with PubMed, you must understand a few concepts. We always type in something. So if I want to search about treatment of IgA nephropathy, I simply type in treatment of IgA nephropathy. This is called as keyword search. So an important word is just typed in and I start my search. So what if this keyword can be refined? So there is something called as mesh terms. So PubMed has mesh terms. We'll talk about that. There's something called as Boolean operators. This is to refine our search. And there are so many filters available in PubMed, which the list can be filtered according to those particular filters. So let's start with simple keyword search. So when you search with a keyword, you get references which contain that word anywhere, in title, abstract, in the paper itself, and the article may or may not be about that word, but that word is there in anywhere in the title, abstract, or the main paper. For example, last night I typed ADPKD and I got more than 6,600 citations. Look at the first citation. It is a case report of some heart disease, and incidentally this lady had ADPKD. So this article has nothing to do with ADPKD, but this is popped. This is thrown by PubMed. So keyword search has this limitation. So what can we do? We can use something called as Boolean operators. These are and, or not. Okay. So these are simple common sense things. If I use and between two terms, so the list of the papers will have both the terms. If I have one more term, the references list will have all of these terms. So that means and is compulsory. So more, if you add, then the number of citations, number of papers will be fewer. For example, ADPKD, I just found 6,600 papers. When I wrote ADPKD and tolvaptan, I could get 401 papers, and when I added children, I could find 27. Make sure that you type and in capitals. Next is or. So if I use or, my search is broadened. So any article that has any of these terms which are separated by or will be searched for. So or means any of these terms. If I write two terms and have or in between, the list will have any one of them. For example, if I type basiliximab, it will have 1700 citations. If I write basiliximab or ATG, the search will be broadened. Any article that has either of or both of them will be put out by PubMed. And if I add and, remember and will narrow, or will expand the search. So the number of citations would go down. This is just to give the example. Again, or must be compulsory. Same thing for not. So I typed basiliximab, I got these many papers, and I added ATG, it refined, and I added not cytomegalovirus. So whichever articles mentioned cytomegalovirus were excluded. So my search got refined. These are called as Boolean operators. So now let's come to field searches. I'll give you one example. If I type Wilson, Wilson could be a researcher's name that may come in author's list. It could be institute's name, Wilson Institute of something, or Wilson College. It could be pertaining to Wilson's disease. So if I type in, any of these articles would come. So about 1.5 lakh papers would appear if I type only Wilson. What if I ask PubMed to do a specific search that I want Wilson, but that Wilson should be author? So I write in square brackets author. So I still get 1,18,000 articles where Wilson is author, whether first name, last name doesn't matter. If I want to search articles where Wilson is there in title, Then I write TI or TITLE. I get 6,000 articles. Then I say not only title but abstract also has to have that. So I write title/abstract and I get many more citations. So we can use field searches for that. So field searches are quite specific and we always get less results than plain word search. So doing a search, you should use Boolean operators, field searches, and let me talk to you about an important concept, MESH. That is medical subject headings. Consider MESH as a tag, a predefined tag that every new article coming in the PubMed, indexers would tag that article with their pre-existing tags. So where do I search these tags? So tags are not created by me or users, they are created by indexers. So I have only a defined set of tags. Where do I search that? So this is the home page of PubMed. Look at this, MESH database. Click on that, you get a search window. I type in IgA nephropathy. So there is a drop down menu. So I know that IgA nephropathy is a predefined tag. So I just click on it. I get such a window where there is a major subject heading, IgA nephropathy, and there are several subheadings. So if I add, I click on this, add to search builder, this automatically is typed in that search box. And when I click PubMed search, I get how much? 7,500 results. And look at what PubMed searched. Look at the search window, search tab. It has written glomerulonephritis IgA and followed by a field search MESH. So whichever article has been tagged as IgA nephropathy as MESH term will appear here. So all the irrelevant articles, like I showed you the Nepalese article, so those are removed. So I know all of these articles have IgA nephropathy as a MESH tag. The only hitch is not all search terms may have MESH terms. So first check if MESH term is there, existing, the tag is existing, and then do that. So how do you do that? How do you know if IgA nephropathy has a MESH term assigned previously or not? And you can search MESH database and then find out one. So here I wanted to narrow the search. So I added the subheadings. Here the subheadings, I am interested in treatment. So I added diet therapy, drug therapy, therapy. Whatever is related to treatment, I checked. And I clicked on Add to Search Builder tab. All of them were entered by PubMed. And then I click on Search PubMed. So my search was narrowed. From 6,000 odd articles, I am down to 2,000 articles. And look at the way PubMed has ordered the search engine. So there are several, this is a long this thing. You can, tomorrow you'll be actually doing these exercises. So we'll come to know how to build a search. Recap. So go to MESH database, search your term, use the term itself or choose subheadings like I did, therapy, and add to search builder. Click search and the search will be given to you as search term in square brackets MESH. Okay, you can add. So what if there is no search, no MESH term existing? For example, there is no MESH term for community acquired pneumonia. So what do I do? So I randomly go to any community acquired pneumonia article. I'll give you the example. Okay, so this was published in 2012 and this article is about community acquired pneumonia. On your right hand side, you can see a MESH term tab. So click on it. So you will come to know the MESH terms that indexers at PubMed, they have given these tags to this article. So look at that. You can see community acquired infections and you can see pneumonia. So you know that there are community acquired infections and pneumonia as the tag terms, that is MESH terms. So you can simply use them. So add and in between. So any article that is community acquired pneumonia is likely to have both of these tags, and these tags will be searched by PubMed. Okay, so that's about the PubMed search. So can it be made easier when we are in a hurry? What do we do? PubMed has this tab called as clinical query. It has given us a set number of filters. You don't have to add anything to it. For example, I've just typed in antibody mediated rejection. So the filter category is either clinical studies or COVID. I have clicked on clinical studies. Filters could be etiology, therapy, investigations. I have chosen therapy. And scope I have kept narrow. And that gave me, I can see 5 of 102 results are sorted out. So if I'm in really, I'm in a hurry and I want to search a clinical query, you can just type any question. PubMed will map the mesh terms and give you a few articles. Mind you, you may miss important articles by if you go through this route, but this is quite easy. Let me come to another case. This is young boy who presents with fever, anemia, thrombocytopenia, and acute kidney injury. There is microangiopathic hemolytic anemia, and you diagnose this boy to have hemolytic uremic syndrome. You send off all the culture, all the relevant labs, and you see that complement factor H antibody is positive. So now what to do? You vaguely remember that one of your teachers have published a paper on this, but you don't remember the exact year or which journal. So PubMed has a way to find that. So go to home page and click on single citation matcher. Single citation matcher. If you click that, you get this window where you can enter journal, date, the volume, issue in first page, author, and title words. Any one of them is also possible. So I just typed the name, selected from the drop down menu, and in title words I wrote hemolytic uremic syndrome. I clicked search. I got these two articles which were written by the author, which had hemolytic uremic syndrome in the title. So this way I can search for accurate articles even if I have broken link. If I only remember that, in 2010 there was this NEJM paper about PLA2R. I can use this feature of PubMed and get to that article. So this is a very useful tool, single citation matcher. So when I click, so let us talk about the anatomy of PubMed page. So I clicked on that article and this window comes. So it describes the journal, when it was published, then there is title and whole list of authors. If you click on the author name, you can get their previous work as well. Affiliations, you can see their affiliations. There is something called as PM ID, PubMed ID. So every single entry in PubMed is given a number. If you get that, copy that number and search, you will get the same article every single time. So this is unique identity of every PubMed entry. You can see this in up to date also. If you see the reference, there is PMID number mentioned. You can just take it and search it. You will get this article right then and there. And then there is this DOI ID also. You can click and get the actual publication. On the right hand side, you can see if it is open access or not. You can get full text from there. You click on a button called Cite. Okay, I'll first finish this thing. There's page navigation, and you can click on the respective tabs to find out only abstract or comment about this article in any other article, similar articles, if this article is cited by any other article, publication type, whether this is clinical trial or cohort study or whatever, mesh terms assigned to this article, then substances means drugs used in this article, related information and other sources. So this is when I click the Cite button. So we know when we are writing papers, we are supposed to write the references in a particular fashion. We can't simply write in any way. So typically authors are listed first, then there is title, and then there is journal name. So every time you don't have to write it yourself. If you click on cite, PubMed will give this citation in a particular format. You just have to click copy, this will be copied and you can paste it on your Word file. So you can actually write the references in right way, right fashion. PubMed cannot find journals not indexed in PubMed. So this is obvious. So that's when you have to search for other databases. One of them is Google Scholar. Google Scholar is a simple search engine by Google, but it searches all the scholarly articles. You won't get newspaper articles here. You will get academic articles. But the scope is wider than PubMed. You can use it in similar way. The basic principles of search remain the same. You can use filters as well. And if you are interested in one particular research topic, you can actually create alert for that. For example, if I am interested in, for example, pentoxifylline in some diabetic nephropathy, if anyone writes about that, if anyone conducts, say, RCT or meta-analysis and publishes, Google search will send me an email that this and this article is published. So I can create alerts for it. So I'm skipping other databases, but this was just introduction. So I wanted to talk about PubMed and Google Scholar. So now I have clinical query. I have framed a right question. I have asked PubMed to give me papers. PubMed has given me 5 to 6 papers, for example. Then how do I make sense of it? So let us talk a bit about hierarchy of evidence according to study design. We are familiar with this pyramid. The base of the pyramid is basic sciences, case reports, case control studies. As we advance, the quality of evidence improves, and the best evidence comes from well-conducted randomized control trials and systemic analysis, meta-analysis and this thing. So let's talk a bit about this. So the bottom of the pyramid is animal studies. A few months back, there was a news, sensational news all across, that a researcher in Tata Hospital claimed that a simple pill can cure cancer and costed just 100 rupees. So everyone was curious and everyone started asking their oncology friends what's happening. But actually this was about a study conducted by a pharmacology department of Tata Hospital in rats. So they found that this resveratrol actually decreased the cell burden, and that's how, but all the media claimed that it cured cancer. So animal studies are at the bottom because men are not mice. So whatever works in animals may not work in men or people. So that is just hypothesis generating. The next is case reports and case series. While it is invaluable source, in my personal experience, I have learned the most from case reports. But they have their own fallacies. Like we knew about COVID based on case reports. So it started with case reports. But there is a huge publication bias. So I would only present cases which are, they may have good outcomes or really novel. For example, this study was published. It's a retrospective audit where they actually conserved dialysis catheters with candida peritonitis. But would you do that? Probably not, because case reports do describe experience, but they are at the bottom of the pyramid. Let me talk about a few other series. So this is a case control study done in South India about CKD-U. So case control studies, actually they are good for rare diseases, where the diseases are rare. You can't conduct prospective cohort studies. You have to enroll thousands of patients to get few cases. Their case control study is very useful, and you can go back in time and find out the exposure. Problem with case control study is it is possible that you may not be able to choose controls in the right way. If control is from a separate, different population or dissimilar population, this study is biased. Cross-sectional study. So we did this study in school children. We simply went to the schools, we checked their blood pressures, and we found out that 7% of school-going children had hypertension. This is called as cross-sectional study. This is inexpensive, happens quickly. We come to know about prevalence. But it has got its own drawbacks. So I can't have causal associations examined in this study. It can give me prevalence, it can give me hypothesis, but it has its own limitations. Cohort studies are better. They are either retrospective or prospective. So we start with exposures and we go ahead in time prospectively to see if outcomes are reached or not. So these are expensive studies. Whatever known biases are there, our statistics friends can help us to negate that, but there are several unknown biases. So that's why the best evidence comes from randomized control trial, where systematically these biases are tackled with. And the last is